Here at the annual meeting of the American Public Health Association, we're focused on this year's theme of rebuilding trust in public health and science. And who better to discuss than this year's president, Greene-Moton. Thank you so much for being here.
Thank you. I'm excited to be here.
I know it was a big build-up, so tell me about some of the highlights this week.
Oh God, starting out Thursday with the executive board meeting. So Thursday, Friday, all day meetings, and just meeting folk that I hadn't seen in a while, connecting, and actually trying to get my schedule together so that I'm where I'm supposed to be when I'm supposed to be there. So that's been part of my challenge.
I think for everyone, and they follow the app and it all works beautifully.
Absolutely.
So you had a major role in these community-based organization partnerships, and a lot of that stemmed from the Flint water crisis. And I feel like that is such a great backdrop for this year's theme of rebuilding trust, because it was a great challenge following that crisis.
It was, and but to be honest, the community-based organization partners, the group that I'm connected with locally in Flint, Michigan, we were in existence long before the water crisis, and I think it actually was the reason we were able to bounce back and deal with the issues, because we were already organized, we were already working and doing that community stuff, right? But being members of the community-based organization partners, being connected with the American Public Health Association and other groups nationally and on a regional and state level, gave us an opportunity to connect with folk across the country and share some of what we learned from earlier programs.
So share some of the keys to that success in that microcosm so that perhaps we can maybe apply that across the country in other communities.
I think we had to learn how to work together. We had to learn how to grow, because even with working with the academic partners and our practice partners, we came to the table locally in Flint, Michigan as 6 individual organizations. And we were not a group that really worked well together. We didn't know each other that well. And one of the issues was that we were all bidding for the same money. So we had not learned how to play well, and we had to understand and admit that, first of all, that we were not working well together, didn't really like each other, but to say that if we're going to do this work, we've got to learn how to do it. So we buckled in and learned how to come to the meetings with one voice, like our academic partners and our practice partners were doing. So just taking advantage of opportunities, recognizing when we needed to make some changes, and being honest about the work and how we develop those relationships, which is really key.
And those are such important points. Beyond that cooperation and honesty, do you have any other advice for people who are here?
Just to say that it's possible. You know, I think there was probably a time when we thought we would never exist beyond the meeting we were in, because they would be so high-powered, right? But recognizing that the issues would take precedence over what I'm feeling or what you're feeling, that we knew we needed to work together. There was a lot of work to be done, so we were able to buckle down and get it done.
When we talk about rebuilding trust, how do you want people to carry that message beyond the meeting here?
Right, and I think when I talk about or think about the rebuilding trust piece, and especially when it's said in the sentence, rebuilding trust in public health, it always makes me think about the fact that I don't know that if it's public health that folk don't trust. I think we have to be honest and say that it's probably some of those bad players that are at the table. So it's not public health, it's folk who are doing stupid stuff, you know? And I don't think people distrust or mistrust public health. It's issues, the things that happen to them, and usually when things are going the wrong way, it's because somebody's doing something that they shouldn't be doing, or they haven't taken the time to understand what they need to do. And so, you know, listening, having conversations, you'll hear me talk quite a bit about empowering spaces. I think that's key. If we can allow ourselves to get beyond ourselves, move out of our own way, and think in terms of creating spaces where we can have those real difficult conversations.
And getting the proper message out. Thank you so
Absolutely.
much.
Absolutely.